Let's get to know more about this highly transmissible Omicron variant. Joining us now is health reform advocate and former COVID-19 task force advisor, Dr. Tony Leachon. Good morning, Dr. Leachon. Thank you so much for joining us. So do tell us, what do we know about the behavior of the Omicron variant? It seems more infectious, as we said, but it also seems that symptoms are mostly mild. So please talk to us about the symptoms, first of all.
Well, the symptoms are basically similar to influenza, like fever, cough, a sore throat, headache, fatigue, and generalized body pain. And then the incubation period is actually fast. You can develop the symptoms in about 2 days, even in patients who are actually in contact with some patients, or even asymptomatic patients. Then you can have also these clinical manifestations. Now, all age groups are involved, particularly the elderly and young age groups, so both extremes of society. But make no mistake, but because of the increase in the volume of patients that we're seeing right now, if it is mild, the Omicron may be has severe or may be likened to influenza, but on a societal basis, because of the increase in sheer volume of infections in such a short time, the risk of overwhelming the healthcare system and affecting the other services of society, for example, for mass transports or workplaces, then it has the tendency also to overwhelm this particular delivery of services and can actually paralyze the economy as well as cause economic recovery. It may not be as severe as the Delta variant, but because of the volume of patients, then it actually can affect work. Because if you are positive, if it is mild, you can still go to work, and this may affect, of course, our businesses.
That's right. It's also affecting some of our healthcare workers as well, because we understand that hospitals are running low on staff in some areas because either their staff has COVID or need to isolate because of exposure. Doctor, can you tell us, how is Omicron different from Delta?
Well, in terms of the manifestation, according to the New York Times, the Omicron spares the lungs. It would only involve, let's say, the upper respiratory tract. So therefore, the presentation may be related to the anatomical area. For example, you have colds, cough, sneezing, and then headache, and then sore throat. And while the Delta, which would actually involve the lungs, will present that way as well: fever, cough, sore throat. But you will have shortness of breath and may lead to severe acute respiratory syndrome that may lead to ventilator. You will need mechanical ventilators, and then will be leading to ICU management. So basically, because of this differentiation, the Omicron sparing the lungs, but involving the upper airway, they may present that way, mild. And Delta, attacking the lungs, may present with respiratory difficulty or respiratory failure, pneumonia, leading to admissions in the ICU and being hooked to a mechanical ventilator.
Right. So it seems more mild indeed, at least. Doctor, let's revisit the appropriate COVID-19 tests that the patients or suspected patients should take. So if one has symptoms, can they take an antigen test? Is that good enough? Or pag may mga sintoma ba po, mas mabuti kung diretso na sila sa RT-PCR?
Well, because of the rapid onset of action, rapid onset of presentation, then you need a fast test that will actually be used. And the rapid antigen test may be useful here, regardless of your symptoms, but more effective if you have symptoms. Because the main question here is that, am I infectious? And since the rapid antigen test result will be available in 15 minutes to 30 minutes, then this might actually tell you. So if it is positive, then you should isolate as well and then get treatment. Well, the RT-PCR may be the gold standard, but it will take a while for you to get the results. And therefore, the particular patient may actually be roaming around and may actually be infecting a lot of persons. So I would say in Singapore, in the US, Canada, and Europe, they're using a lot of the do-it-yourself or self-administered kit, the rapid antigen test. Now, if you are negative, let's say for the rapid antigen test and you have symptoms, then you can proceed to the RT-PCR to verify. So basically that's it.
All right. So if you are symptomatic, it's okay, more than okay to take a rapid antigen test to start with. On a last note, Doctor, controversial question. Are you in favor of bringing back the face shield policy?
Well, I think that has been discussed already by the IATF and the MMDA. The face shields have not been included in the recommendations of the CDC and not even in the World Health Organization. I think the role of face shields as elucidated in the MMDA resolutions is basically to use it in medical facilities to protect the healthcare workers. But in open spaces, then you can actually have your mask or you can have a double mask. And also you can use the face shields in those congested and crowded areas. So generally, I'd like to follow the CDC recommendations as well as the World Health Organization. And face shields may not be the real plan of action here. It should be reduce mobility, of course, that is important. And then, of course, together with your minimum public health standards. But I think we need to fast track the booster for those actually with 2 doses. The right thing to do is actually have your booster right now. And of course, fast track as well the vaccination program.
All right. Thank you for that and for your time this morning, Dr. Tony Leachon.